Hey, Mama. All right. To answer your question about why a child who is originally potty trained will suddenly regress and start to wet themselves once again, I would like to share a story with you, an experience, my own experience with you. So, you see this tooth. I lost this tooth when I was 3 years old. I was just 3 years. It was a milk tooth, of course. I was in nursery school, St. Gerard's nursery school, and every time at break time, I remember that what we did was we would make a long line from the water closet in the toilet to wherever that line ended. It meant that everybody was asked to go and pee, and a bunch of 3-year-olds would make a long line, and the first person would be right in front of and pressed against the water closet. What the person would do is the person would turn around, pull down their okay, it's like a girl would turn around, pull down her pants and pee, then pull up and wriggle out, so that the next person, perhaps a boy, would pull down his zip, bring out his penis and pee and pull up and wriggle out. I didn't like that. As a 3-year-old, I did value my privacy. I didn't want a bunch of 3-year-olds all over the place while I was trying to pee, because at home I didn't experience that. At home, if I wanted to pee, I'd go into the toilet, I would shut the door, I would pee in my privacy, and I would come out. I didn't understand why 3-year-olds had to be, maybe like up to 7, had to be inside the little toilet room that I was trying to pee. And so what happened was that I would sit down while the entire peeing session would go on. And most often than not, I would pee on myself. I guess I don't know if my mom or the help who picked me ever worried why I would pee or poo on myself. I remember her being really, my nanny being really irritated that she came to take me and I was carrying poo poo in my pants, and she had to put her big palm under my buttocks to carry me so that the poo poo wouldn't spill over. I don't know if she ever figured out why I wouldn't poo or pee at school and instead do it on myself. I don't remember if I was spanked. Maybe my mom was so, loving, she didn't let me get spanked. I don't quite remember. But I do remember that I used to pee and sometimes carry poo and mess up myself. And this was the reason why I did that. So one day, because I wanted to ensure that I had privacy while everybody was done peeing, and I went into the toilet to doubly ensure privacy. I closed the door and bolted it. It's an inner bolt. The door closes in, and I bolted it from inside. I peed, prettily peed, and when I was done peeing, I couldn't unlock the bolt. I banged, I screamed, I wailed, I cried. But because it was end of school period and they were praying, those times when it's now the day is over, night is falling, drawing nigh, shadow, and they're singing. All those songs they sing to end the day, those times, right? And they were singing gleefully, and nobody heard me. And so I cried and cried, and in my desperation, I used my teeth to try to pull the bolt back, and of course, one, this milk tooth fell off. Two things happened to me. One, I felt, because when I was eventually discovered after my tooth had fallen and blood was splattered all over my clothes, they had to take my clothes off to go and wash blood off the clothes. And guess how I was while they were washing blood off my clothes? Naked to my pants. It was so embarrassing. So embarrassing. So two things happened to me. I was hugely embarrassed being kept naked right there while I waited for my clothes to be washed. And of course, it had to be squeezed dried or something. And I waited naked throughout that process. It was traumatizing. I don't know why when they ask of core memories, I don't remember this. Funny how I remember it so easily now. And then the second thing that happened was I felt my privacy constantly breached by the peeing process, and I didn't like to pee in the toilet or pool. I'd rather do it on me because I didn't like that breach of process. Now, this is a story from my 3-year-old self that I vividly remember. Now, going back to your 2.5-year-old daughter, I'd like you to ask yourself some questions and answer them so that it can help you, wrap your head around her experience. Number one, how frequently has she been doing this? Has she been wetting herself in the daytime? Does she do it several times in a day, or maybe several days in a week, once a week, or once in 2 weeks? How frequent is it? This will show you how bad whatever the reason is, how persistent whatever that reason is, really is, right? Then, second question, where does it happen most often? Is it at home that she wets herself more often? In the frequency that it occurs, the several times in a day or the several days in a week, or that frequency that it occurs, where is the most frequency? Is it at home or at school? You need to find out. This helps you to check the specific pattern. The specific pattern within which it happens will tell you how to unravel what the issue might be. So now let's go to the reasons why a child who has been originally potty trained might suddenly regress, right? I will just list them quickly and then explain them. Now, number one is stress. Stress is one of the major ones. Number two is trauma or fear. Number three can be fear of missing out. This is psychological also. Then number four, I beg your pardon, would be medical reasons. And then number six is under number five, I wanted to say constipation, but that is also a medical reason. Okay, so there are 4 reasons why this could happen. All right, so now taking it from the top, now let's start with stress. To tell you about stress, let me mention about my son, my 10-year-old. When he was about 2, some patterns changed in my schedule. So I didn't have a help anymore, and I didn't have my cousin living with me anymore. So it meant that it was just he and I had to drop him off at school. Then when it was about 5 o'clock, when the school had to close, because I paid for after school period, I would go to school, pick him up, and then take him with me to work. And he would stay at the office with me. Sometimes we would stay till 8. In some rare cases, which did happen, we would stay till 10 p.m. and then I would take him home. Every time I took him to the office and stayed into the night, more often than not, he would wet the bed. Now, just as your daughter, my son became completely potty trained by 1.5 years. Completely, totally. He would wake up at night by himself, go into the toilet, pee, and come back to the bed. The only reason I would know he got up is because anytime he would stare, I would wake up, because I started to sleep very light because of him. So that's how I knew that he got up to go and pee. If he didn't get up in the middle of the night to go and pee, he would wait until morning, and once I woke him up, he would go straight to the toilet to go and pee. And that was him at 1 year and maybe 1 year and maybe 7 months, right? So at 2, he started to wet the bed, but this was related to stress. So there are so many things that could stress a child. I've already told you one: a change in schedule, new daytime patterns for the children. So if you change the patterns that they have for their daytime, maybe you are the one who your schedule has changed, your work schedule has changed, and the child now has to stay longer out than they used to. And this could make them get too tired out. They would pee, but this is peeing through the night. It's not peeing in the daytime, which is what you're complaining about. Now, for the daytime peeing, the patterns of stress The patterns that could stress a child out are if a child has a new sibling, like there's a new baby in the family, the child is just under stress, under pressure. I don't know how that works, but it just stresses the child out that there's a new baby, the baby is always crying, nobody's paying him attention, this, that, you know. When that happens, it could stress the child. It could make the child, as a matter of handling that stress, pee on themselves. That's daytime peeing. Another thing that could happen is if the child has moved to a new school. That school you're speaking about, has your child just moved to it recently? Going into a new environment, they don't know what's going on there. They want to be able to, take care of themselves. They know exactly where to go, when to go, how to handle themselves. They are probably even so skeptical about the new place. They pee on themselves because they don't want to go and find out what's going on in that maybe scary place they call a toilet. That could make the child pee on themselves. Another thing, if you have moved to a new house, so you are in a new home, just the same thing as a new school, the child can be unsure. The child can just be overwhelmed by all the newness and all that, and instead of trying to find out where the toilet is, or not even being comfortable with going to that toilet all by themselves, despite the fact that it is something that they've always done before, they will pee on themselves daytime. Now, if they have a new nanny who is probably doing things differently, it could stress them out. It could cause them to start peeing on themselves. Now, if there is domestic conflict in your home, for instance, there's been a divorce, or there's been some domestic violence, or things that the child is not used to in their closely knit home, this could stress the child out. And one of the ways that children express that kind of stress is involuntary bowel movement or involuntary bladder movements. Okay, so these are some reasons why a child could be stressed. There are others, but these are the major reasons why a child could be stressed. So that's number one. A second reason why a child could start peeing on themselves despite having been potty trained prior is trauma or fear. Now, that fear, maybe something scarred. When something leaves a scar on you, something happened to the child that scarred the child, and it could cause it to go through recurrent fears. And anytime he remembers this, incontinence is one of the consequences of such trauma. Their inability to hold things in their bowels or their bladder together. So trauma, that kind of trauma that causes recurrent fear, could cause a child to regress from their prior potty training. If a child is experiencing bullying, like when they go to pee, there's someone there who picks on them. I forgot to tell you that in my nursery school, there was this guy, Chimaroke. Now, what Chimaroke did every time I went to pee in the toilet is he would hold me in a straddle and lift me off the ground. And this was me who was trying to pee. I didn't like it. It was intrusive. I felt intruded upon. I was a 3-year-old. And because I didn't want somebody intruding on me, why are you carrying me? Am I a baby? You're carrying me up. Did I come to be carried up? I want to go and pee for Pete's sakes. Right? And so I didn't want Chimaroke to be doing that. I felt so that could fall in the spectrum of bullying or being picked upon while trying to pee. And so because they don't want to do that, they're afraid of being bullied or being picked upon. So they won't go to use that toilet or that potty. Sorry, they're going to do it on themselves and come tell you so you can go take them. If they come to ask you to take them, maybe you won't. Who knows? I don't know. So they would rather just do it on themselves and come and report themselves to you, as your daughter is doing. Another thing, they might have experienced, okay, this is related to what I just mentioned, bullying. Them having experienced something while in the process of peeing that they didn't like. And children experience things with all of themselves, like one big sense organ. Their eyes, their ears, their mouth, their skin experiences that thing all together. So if they have gone through something while in the process of trying to pee, sorry, they are regressing, right? So these are the things that you need to have in mind and that will need you to check to know why exactly your child is suddenly lost their potty training. Okay, so the third number, I've talked about stress and the reasons that will cause stress. I've talked about trauma and fear. Now let's talk about the psychological experience they have, the fear of losing, of missing out. My own son is also an example. When he was about 2 to 3 years old, he still loves to play, as a matter of fact. He loved to play so much that he would get so busy playing that he will not realize that he needs to pee until he is so pressed that he wouldn't make it to the toilet before the pee comes out. So you see him, he's dancing. Sometimes he's dancing. I go like, do you want to? Even up to 7 years. I'll say, but do you want to pee? You say, are you pressed? You say, yes. I said, go and pee now. If you left him, he wouldn't know that he wanted to pee. This was him at 6 and 7. Now, at 2 to 3, he would practically pee on himself because he's playing. So toddlers have this thing of feeling that they might miss out on a lot if they go to pee. So they don't go, they trap it in. So does your daughter love to play? Now, when she got potty trained at 1 year plus, she probably hadn't gotten so conscious about the act of playing and playing intentionally and with other people and enjoying play as much as she probably does now. So if that difference in timing, the way she was at 1 year plus and now that she's 2 year plus, could just mean that she gets too busy playing and she doesn't want to miss out on the fun that could happen if she goes. So she would pee on herself and later tell you, so that she's feeling uncomfortable. Let's change this thing and get something new. Now, let's go to something more serious. There could be medical reasons why your child is peeing on herself. Number one, which is the most frequent is constipation. Now, when a child is constipated, the poo is too hard. When it is too hard, they tend to associate that pee being too hard with their inability with also peeing. So if the poo is too hard to come out, the pee might be too hard to come out too. So they just want to not even try any one of them. So constipation is something that really does need to be checked, because there is even a medical report that says that up to 70 to 80% of children who have accidents of peeing on themselves during the daytime is because they are constipated. Why this is so is because the bowels are positioned close to the bladder. So when the bowels are full and you don't empty the bowels, the stool inside the bowels will put pressure on the bladder, and once there's much pressure on the bladder, or the bladder cannot empty completely, the pressure causes the child to wet himself or wet herself. So constipation, having the bowels always too full and the poo too hard to come out, it will put pressure on the bladder, and constantly the child will be wetting himself. Another thing right under constipation is, this is not a medical reason, it's probably just that kind of impatience. A child who is in a hurry to get back to whatever they were doing would get into the toilet and they would pee, but they wouldn't empty their bowels completely, the bladder completely. They will still leave some pee in there. That pee that is left will definitely somewhere along the line come raining down on them. So that is another reason. Okay, then one more thing, going back to the medical reasons. My nose is itching, I don't know why. As if I have as if I have an allergy. Now, one other medical reason that you need to pay attention to is this one is a bit more serious. A urinary tract infection, a UTI, can cause incontinence. Okay, so if there is a urinary tract infection, it makes it difficult to get to the toilet fast enough. This even happens to adults. It's happened to me. I found out that every time I laughed, I would pee on myself. Every time I coughed, the cough didn't have to be, a guttural cough, just like cough. Anytime I sneezed, I would pee on myself. And so I went to the hospital, like, doctor, what's going on? And it was a urinary tract infection, which I had to take antibiotics to clear. And so if this is the case, yes, your child might need medical attention. Also, another thing that could cause it is diabetes. Does your child have a case of diabetes? Do you have a case of diabetes in your family? These are things that you need to check. Okay, so these are so many reasons. There could be more, but these are several of the major reasons that could cause your child to, who originally was potty trained, to regress. Okay, so you see that these things I've mentioned, when any of these things is the matter, is the reason why your child has regressed, you see that scolding the child or spanking the child will not fix it. It's actually unkind that any of these things is the matter and you're scolding your daughter or spanking her. That's actually unkind. So what you need to do, ask a lot of questions, check the patterns, find out exactly what the problem is so that you will know how to fix it. So what are the things that you can do if your child is constantly wetting themselves during the day? First of all, set a bathroom schedule. Set a bathroom, like maybe you need to do it every 2 hours. You ask the child, do you want to pee? Do you want to use the potty? Or you take the child, right? So if they say they don't need to go, encourage her. Just go, or go with her. Or have somebody who does that, who goes with them and encourages them to just sit in the toilet and pee whatever little is there. And then you need to have conversations with the child, with your daughter, to find out if there is something that happened to them. You see the story I told you, my mom is on this road. I bet you my mom probably never heard this story ever before. I don't know if she will remember that I used to pee on myself and poo on myself, right? But I bet you she probably never heard that I used to feel uncomfortable with people being all up in my space when I tried to pee, and that I wanted my privacy so much that I would do anything, and that included just peeing on myself so that at least I didn't have to have somebody in my space while doing it, right? So you need to talk with your child, your 2.5-year-old. Find age appropriate words to use to have a conversation with her to find out what the matter could be. It won't happen in one day. You're going to have this severally at different occasions, raising it out of nowhere. And then, is that why you peed on yourself today? Because maybe somebody, or is that what happened? Or, just asking questions, making suggestions, seeing what you come up with. Talking with your child would help you understand what could be causing them maybe a fear. For some children, I don't know, it could be the sound the toilet makes when you flush. That sound scares the booties out of them and they don't want to be there. So for them, they just want to use a potty somewhere that is not inside the toilet, because your juju calabar, the NG is inside that toilet. So don't even put my potty in there where that masquerade, where that ghost is going to carry me. So put the potty elsewhere. So these are things that you need to find out by talking with your child, okay? And then you need to teach your child, for if she's one of the children that are in a hurry to to get back to play. You need to teach her how to relax and take her time so that she can properly empty her bladder. Because if she empties her bladder properly, then there will not be any reason to let the rest rain down, right? So your child will also need to eat plenty of vegetables and fruits, drink a lot of water and enjoy a lot of physical activity. Now you're going to ask, a child who's already peeing herself, why is she drinking a lot of water? The answer is simple. If your child is peeing on herself, it might be because she's constipated. And because she's constipated, it takes her a very long time before she gets to poo, because pooing is difficult, even when she feels uncomfortable. So she doesn't want to go and associate herself with that activity. And so when the other one that is not poo, the number one now comes out, she will think, if number two is stressing me, number one will still stress me. So let me just manage it as I can. And so she's going to pee. So making your child drink more water, eat a lot of fruits and vegetables, is to release the bowels, to soften it, to make her loosen the constipation in there. Now, if your child is taking a lot of fizzy drinks and caffeinated beverages, please bring that down. Up the water, bring down the caffeinated beverages. This would increase urine output because it makes the bladder more active. So you need to, if for instance your child is having an issue with keeping poo, I beg your pardon, getting fast enough to the toilet when they feel like peeing, it means that she would need to go more often, right? If this requires that you for instance take a doctor's note to your school to ask that your child be allowed to go to the restroom as often as she needs and take as long as necessary, as often as she needs, so that she gets to do it more frequently in the bathroom, in the toilet, rather than on herself, and for as long as necessary, so that she actually gets to empty her bowels properly. If a doctor's note to your child's school is going to fix that, then that might also be something you need to do. Now, if her school is not a place where they do school uniforms, you might need to send in a change of clothes for your child, so that should she wet herself, and she can have a change of clothes. And if this place is a place where, as I said earlier, no school uniforms, try to get them to try to pack in some dark clothing, like dark jeans and dark colored clothing, so that she's not overly embarrassed when this happens. Okay, then finally try to check out what are the things that could be stressing your child. Try to talk your child through it. If you are under stress, chances are, depending on the level of your stress, it could also stress your child. Stress is contagious. But if you're not stressed, find out what might be stressing your child. It could be any of those things we listed at the beginning. A new sibling. I put up a post yesterday about a boy who shifted her baby brother so that he could cuddle with his mom. When I was asking what you would do if you were the mom, if you were going to scold him and tell him so many reasons why he shouldn't have done that, and how he could have crushed his baby brother and all that. Now, having a new sibling stresses a slightly older sibling out. So if you're having a new baby in your home, chances are it might be stressing the baby's immediate older brother or older sister. Try to check that stress for the baby. And so many other things. Is that did you move to a new house? Do you have a new nanny and all that? Check all this, and this will greatly help. I hope that this has been quite helpful, right? And remember, you need to, first of all, before you check all these other things, one thing I need you to do is take your daughter to the hospital to zero out the medical reasons. Zero out a UTI, zero out aggravated constipation, right? And maybe find suppositories. Maybe you might get suppositories to help with the movements down there, and then zero out diabetes. If you zero out these three core medical reasons, then you can slowly start to check the other ones that are non-medical. Okay, I wish you all the best, mommy, and I hope that you're able to get your child back to that point where she's potty trained. Potty training regression could be such a huge concern. I do understand that, and I understand how that should be such a concern too. But please, mommy, don't scold her anymore and don't beat her anymore. Okay? I'm rooting for you. I'm sending you all the love and all the encouragement. And do let us know if any of this works for you. Okay? Ciao. Bye. Good night.